are you? My name's Rachel.
Rachel,
How are you doing today?
fine, thank God. I'm doing well.
What's our patient's name today?
My patient's name is
What is,
Abakar Adamu. Is a 2-year-old presented with history of fever, passage of loose stool, and abdominal pain for 3 days.
okay, how high has the fever been?
Yes, it's high fever, intermittent.
Okay, do you know the degrees of it?
Yes, it's 37.9.
Okay, thank you. Have you done a blood culture or test the stool?
Yes, we've done a blood culture,
Mm-hmm.
and it shows that there is salmonella in the blood culture. We cultured salmonella.
Okay, thank you. Have you tested the hemoglobin?
Yes, the hemoglobin is 7.2 gram per DL.
Okay, thank you. For this child, I'm going to say he has typhoid fever and severe
Yeah,
anemia.
severe anemia. Yes.
And we would treat that with antibiotics.
Yeah.
And then for the anemia, we would give him a blood transfusion for the iron.
Ah, that is good. That is good. That is good. Impressive. So, what other thing would you like to do to the patient?
Well, after you've given him a blood transfusion, we should follow up with an ACT.
Yeah, that is good. Thinking of malaria?
Yes, have you done a
Yes.
rapid diagnostics?
Yes, rapid diagnosis test showed that he's positive.
Have you done the smear? Yeah.
Yes, microscopy is positive, 2 pluses.
Yes, so you give him an antibiotic with the blood transfusion.
Yeah. So now after treating your malaria, you treat your malaria, you transfuse the patient for the anemia, isn't it?
Yes.
And then you treat him with antibiotic for the typhoid.
Yes.
So now your patient is ready to go home.
Yes.
What other advice would you like to give the patient?
For preventing malaria in the future, if possible, wear long clothing and make sure you're sleeping under mosquito nets so that the child is less likely to get bitten.
Rachel, that's good. I'm happy to hear that.
Thank you.
So now that salmonella has been cultured.
Mm-hmm.
What advice would you like to give the patient when he's going back home?
Make sure when you're eating foods, either cooked, that they're cooked all the way properly, and that you're washing your hands before cooking or eating your food.
Yeah, that is good. What about environmental sanitation?
Make sure you're bathing yourself, keeping as clean as possible.
So what other thing? Would you like to tell your patient anything anymore?
Can you please tell him that we hope he gets well soon and that they have a very good day?
Yeah, that is good. They are saying also that they are wishing you a very good day, and they are happy to be with you.
Thank you so much for letting me treat you today.
Rachel, thank you very much. Thank you very much. I'm happy to have you.
Thank you.